Welcome back to the Holistic Health Bites podcast. Today, we are going to talk about a brand new study that specifically looked at medications versus intermittent fasting protocols for type 2 diabetes. And it was just published in 2024. Now, this study was published out of China, and it looked at an intermittent fasting protocol compared to two different common diabetes medications. Now, this was a randomized clinical controlled trial with three different groups, and they looked at them over 16 weeks with an 8-week follow-up. Their primary measure was hemoglobin A1C between the beginning and the end of the 16 weeks. All participants were newly diagnosed with type 2 diabetes within the last year. They had not been on any anti-diabetic or weight loss medications for at least 3 months. They all had a BMI of 24 or higher and an A1C between 7 and 9. They also looked at secondary metrics such as weight, BMI, waist circumference, hip circumference, waist to hip ratio, blood pressure, fasting glucose, fasting insulin, fasting C-peptide, HOMA-IR scores, lipid profiles, and uric acid levels. And then they made comparisons between the starting level and the 16-week level, and then again at an 8-week follow-up mark. There were 405 total people randomized into one of three groups. One group was using the pharmaceutical drug metformin. One group was using the pharmaceutical drug commonly referred to as Jardiance. And the third group was following an intermittent fasting plan along with a meal replacement shake. All participants were given exercise and dietary guidance, as well as diabetes education every 4 weeks. Now, before we dive too deep into the results of this study, I want to break down this intermittent fasting plan just a little bit. There are countless ways to follow an intermittent fasting plan. This particular study used a protocol called 5-2 with a meal replacement. What that meant was that they ate their normal breakfast and lunch 5 days of the week, and then they replaced their dinner with a meal replacement shake. On the other 2 days of the week, which could not be consecutive, they only had a meal replacement shake. They didn't have any other food those days. So those were super low calorie days. Now, this is not the only way to do an intermittent fast, although it is a popular method. Some people find that consuming a small amount of food, in this case, 500 to 600 calories on that fasting day, is easier than not having anything at all. Others find that it's actually harder and they're more hungry if they have a little bit of food rather than having no food, as weird as that sounds. Okay, now back to the results. Of the 405 initial participants, 332 made it all the way through the 16 weeks of the trial. At 8 and 12 weeks, so partway through the trial, there were no participants in the intermittent fasting group that had blood sugars rising to the level that required medication. They did have one participant in the metformin group that had fasting glucose of 218 and actually needed additional medications to manage those levels. At 16 weeks, the intermittent fasting group had the greatest reduction in A1C, significantly greater than those receiving either medication. Now, there was no difference between the two medication groups. More patients in the intermittent fasting group achieved A1C levels below 7% than either of the medication groups, with 80% of the participants achieving levels 6.5 or lower. Fasting glucose also dropped more significantly in this group at 30.3 milligrams per deciliter on average. At the end of the 8-week follow-up, 76.6% of the participants had still maintained their lower A1C below 6.5. At 16 weeks, the intermittent fasting group saw the greatest weight loss at 9.7 kilograms, or about 21.34 pounds, compared to only 5.5 and 5.8 kilograms for the metformin and Jardiance groups, respectively. And more patients in the intermittent fasting group lost weight compared to the medication groups. The intermittent fasting group also saw the most significant changes in waist and hip measurements, and in blood pressure. They also saw the best improvements in triglycerides and HDL levels. Side effects were also less common, with only 1 case of constipation and 8 cases of hypoglycemia in the intermittent fasting group. The metformin group had 26 patients with GI distress and 8 with hypoglycemia. And the Jardiance group had 3 patients with urinary issues, 5 patients with hypoglycemia, and 1 patient who experienced thirst. 2 patients in the Jardiance group also experienced serious adverse events, such as rash and needing to be hospitalized due to high ketone readings. Now, as always, remember, this is only one study that looked at newly diagnosed type 2 diabetic patients in China who had not been on diabetes medications or weight loss drugs in the last 3 months. This does not mean that the same outcomes would occur in all demographics, nor that this is the best plan for you to be following. None of what you've heard today is medical advice, and you should always work with your healthcare team to determine the best protocol for you. There are countless natural options, including nutritional ketosis, low-carb diets, intermittent and extended fasting plans, strategic supplementation, and even medications. Most often, truly reversing a condition like insulin resistance, prediabetes, or type 2 diabetes requires a combination of nutrition and lifestyle factors. Now, I'd love to hear from you on this episode. Join the Solving Insulin Resistance Naturally group on Facebook, and let's continue the conversation. Until the next, be well and vibrant.